Hello everyone. Welcome to another exciting edition of the Revenue Innovation Series. I'm your host, Dan Murdoch, and it's my absolute privilege to welcome a very special guest, Tennille Lizzaraga, EVP of Revenue Cycle Operations at ApolloMD. With 40 years of experience, ApolloMD is one of the most successful firms in the clinician outsourcing services industry. Their operations represent nearly 2,000 emergency medicine, hospital medicine, anesthesia, and radiology providers across the country that are responsible for treating millions of patients each year. That is no small feat by any measure. Tennille, welcome to the program.
Thank you. Thank you for having me.
Of course. It is customary that we start with a brief introduction about you and your leadership experience here at ApolloMD. Tell us a little bit about that.
All right, Dan, I started in 2006 here at ApolloMD, and I was actually I came in as an accounts receivable representative, and my main function was to work claims daily to make sure that insurance carriers were paying for the services that were provided by our clinicians. And throughout my 17-year, almost 18-year tenure here, I have moved up in position from account receivables rep to director, and then I was a manager, and now I'm the executive vice president of Revenue Cycle here at ApolloMD.
That's incredible. How did you rise through the ladder so quickly and so efficiently?
I really love what I do every day, and the ApolloMD team overall is just an exceptional team to work with, and they always have been. They are very supportive. There's lots of opportunity here at ApolloMD that I was given, and I took advantage of that as I saw it being presented by the leadership here. And I enjoy coming to work every day.
That's amazing. ApolloMD is clearly a leader in so many different ways. That's a perfect example as to why. Tell us a little bit more about the ApolloMD difference and how you guys stand out in this very crowded and competitive space.
Well, my COO would probably say it's based on our clinician and employee ownership, and the fact that we don't have any private equity in the company, and we run at very low debt. But I'm over RCM, so I would say that it's our ability to pivot and navigate through the numerous changes that the industry has seen over the past 10 to 15 years in regards to healthcare coverage, how insurance carriers behave. We've really had to stay on top of being knowledgeable of how the carriers are going to move next. Because in order for us to kind of stay a step or two ahead, we have to kind of be right there, at those moments when they change their behavior, and look to technology has been one of our greatest investments.
Incredible. And to the point around RCM and all of that factors into the success of an operation of that size and that scale and the diversity of your clients. I imagine teams and people are such a critical variable in that equation. Can you tell us a little bit about the keys to success in building really great teams that are sustainable and create continuity and continue to evolve over time to the effect of what you were just describing?
Yes, absolutely. The teams are critical. From our AR teams to our middle management teams to our leadership teams. We need the support from the leadership teams in order to be innovative and stay ahead and be on that cutting edge. But our middle management teams and our staffing teams are really kind of what make daily operations for RCM run. And part of that is empowering them to do their jobs, be really good at their jobs, and giving them the tools that they need to accomplish those two things. Yeah. And I think we've been really successful in keeping a very lean staffing model, but empowering them to the point where they are super effective in making sure that all of our RCM operations are running smoothly day after day.
That makes so much sense, and I think to the effect of how you're empowering that team every single day, of course, technology plays a very significant role in making them the best that they can possibly be or putting them in a position to be successful. How has that evolved over the last 17, 18 years that you've been with
ApolloMD?
Tremendously. I can imagine that's been quite the journey.
It has been. Over my journey here at ApolloMD, which has been my longest actual employment run in my lifetime, I have seen massive innovations in technology, and it's really because of carrier behavior changing. So in order to maximize our cash collections, we do have to invest in technology, which we have done so. Being able to reach out to payer portals, being able to reach out for eligibility checks and verifications, claim statuses. Go back 17 years, account reps were doing this manually, picking up the phone, checking benefits, checking, verification, checking claim status. Now, what we're using is technology behind the scenes through AI and machine learning to do some of that for us, the heavy lift, so that our reps can work on the more complex processes of dealing with insurance carriers today.
And the most high impact activities, they can focus on those things as opposed to the ocean of possibilities.
Correct.
And, that's so tremendous to hear that you guys are such on the leading edge of adoption of technology. It's so critical in the here and now. And as the diversity of payers, as the velocity of changes are happening, it allows you to stay on the front foot, which is amazing. I'm gonna borrow a quote here from Amy, your COO and fearless leader. She was quoted as saying, "In today's challenging healthcare environment, the need to maintain viability to our hospital-based physician groups is critical. We need to be able to recognize and respond quickly and appropriately to the issues surrounding each mechanism of denials by the insurers." Tell us a bit more about that. I can imagine there's many different versions of challenges that are in relation to what Amy was saying, but tell me a little bit more about your perspective there and experience.
Yes, Amy has touched upon a very important part of RCM nowadays. Denials have always been there. What has changed is the rate that the carriers are now denying claims and the reasons for which they are denying claims nowadays. And the carriers will, kind of change their behavior without telling the providers and the clinicians. And we have to really try to be ahead of that change. And the way to do that is data driven, right? We're not sitting in the adjudication system at the healthcare carrier to understand what's about to come to us. By the time we get it, it's done already. So what we need to do is be able to identify those denial trends as quickly as we possibly can so that we can troubleshoot those and root cause them and see if there's some way internally that we can fix the claim before it goes out the first time so that we can avoid those particular denials or respond faster to the denial if we can't actually, clean it up upstream.
Amazing. And for our audience's sake, give us an understanding of the complexion or the diversity of the number of payers and types of claims that you guys are managing.
Well, we roughly see about 3 million patients a year. So every patient has a claim of some format, right? Whether it's self-pay or if it's insurance carrier based or auto related. And each of them come with their own challenges. The health insurance carriers are the ones that give us probably the most challenge because there's so many health insurance carriers out there. I know most people are like, oh, it's Blue Cross, Humana, United. Well, within those companies, they're geographically broken up. So you may have Blue Cross Blue Shield, but then you have maybe like 38 different versions of Blue Cross Blue Shield within the country. And understanding how each of those operate is the challenge because one geographical Blue Cross may require A on the claim, but geographically over here, Blue Cross Blue Shield requires B on the claim. Same claim, just different guidelines. So that's one of our biggest challenges when we go into a new geographical location is trying to understand the payer requirements before we actually start billing.
It's like a giant jigsaw puzzle. It almost feels like it's 5,000 pieces and you guys are constantly analyzing where they all fit in order to preempt a potential denial, right? It's such a tremendous challenge.
It's a tremendous challenge. I would probably associate it more with looking into a kaleidoscope every day because it changes literally that rapidly.
Incredible.
Yeah.
Incredible. Speaking of challenges, I wanted to ask you if there's a particular phase within revenue cycle management that you find to be the most challenging. And I realize that's a difficult question because I think the whole spectrum is challenging. There's so many jobs to be done, but in your experience, what do you find to be the most?
Well, our service line of emergency medicine specifically probably poses challenges in the front end of RCM and the back end equally, just because our population through the ED is anyone, right? We have uninsured, underinsured, insured. They don't know if they're insured or who they're insured under. So in the beginning of the rev cycle for emergency medicine, eligibility and coverage is a huge challenge. Securing the coverage detail that we need in order to get that claim out to the appropriate carrier for processing is very challenging. And the back end with the denials, which we've touched upon. Because you're dealing with the population of everyone at the ED, you're also dealing with the population of all possible carriers. We don't really know what's coming at us because there's no pre-registration for the ED, there's no scheduling, we don't check eligibility before they come in as if you were in a PCP office. So I would say the front and the back end.
I'm certain much of our audience would align with your statement, but looking at it with the glass sort of half full, it then means that there's this opportunity of sorts for technology or automation to help alleviate some of those common pitfalls or challenges within RCM. Are there examples of areas that you see automation playing a role here? Yes,
and some of that we actually utilize here at ApolloMD. On the front end for eligibility, we have a partner who will actually take our patient data as it comes into us from the hospital and will ping the portals, the carrier portals, to check if that insurance information is actually accurate, if it's active, and if our date of service is within the active period for the policy. And then it will return to us updated information. We may have had the patient's name spelled incorrectly, or the alpha prefix is not absolutely correct for this plan. So we take that data and ingest it, which allows us to push cleaner claims out faster.
Yep. And I imagine payer portals and others would be good examples, correct?
Yes, and that's exactly what they're utilizing to get that eligibility check. They have to go out to the payer portals to receive that information back.
Excellent, excellent. And we're a proud partner of ApolloMD's, and certainly would love to hear, the role that we're playing in this innovation equation for you, and what our journey has been like from your perspective.
Well, I was very excited when our leadership team came to me and introduced Adonis to me and my team and said, hey, we think based on what you've been discussing and talking to us and asking us for and explaining to us, this may be a partner that could kind of bring those things together for you. And basically what I've been asking for is a dashboard of data analytics of our revenue cycle inventory in a very easily read, user-friendly format. So when we first started working with Adonis, I loved that the engineering team was very focused on what we were asking and talking about. They understood it as well. So it wasn't like we were explaining the need and the purpose of the need, which kind of makes things go a little bit slower. So that was definitely a positive point of partnering with Adonis during the implementation phase, which I think allowed us to also get to the start much faster when we went live. The dashboard has been amazing, and my team, who's responsible to oversee geographical areas of our AR, utilize it daily. They're responsible to, bubble up any issues that they're seeing within the Adonis dashboard, the revenue cycle intelligence dashboard, and we have seen many benefits already. And we went live, I think it was June of last year.
Yeah, I think the best is still ahead of us, certainly. And the one thing I always come back to is, we're helping to put your team back on the offensive as opposed to being on the defensive. Yes. Is that an accurate sort of description?
That's very accurate. It's allowing us to identify issues before they become really monstrous. So unfortunately, before Adonis, it would take us a little longer to identify not only the issue, but how impactful the issue was on our entire book of business, because we're segmented into different facilities. With Adonis, if we have an issue, it immediately will identify it for us, and it will bubble up all of the impacted inventory associated to that particular denial or hold or edit that we're seeing.
Exceptional. Well, again, the best is still ahead of us. We're really excited about how we will continue to partner and innovate together. I'm interested to learn how, over time, a specialty-specific approach has benefited you and the RCM organization, right? No provider is the same, right? Mm-hmm. And as you were thinking about the diversity of payers and claim mix, all of those things, mm-hmm. how has taking a specialty-specific approach allowed you guys to drive more predictable, better RCM outcomes on behalf of your clients?
Well, it's, I always say this to my team, and we have to be masters at what we do. We perform much better when we know what we're doing, right? And we know it very, very well. And even in my management team, I separate the service lines specifically to a director, because I want you to be the master of emergency medicine. I want you to be the master of hospital medicine. So it allows you to focus to become exceptionally intelligent in that service line when it comes to billing guidelines and requirements, coding. So specific assignments have always had a better result than having somebody all over the place.
Entirely. I think that's a really important principle and what makes you guys so different. And we're taking that a similar approach from a technology perspective. We want to go as deep and as rich as humanly possible mm-hmm. on the needs and nuances of a particular provider, because mm-hmm. that's the devil's in the details, mm-hmm. right? And
Absolutely.
That is certainly the difference between success and failure over time. We're nearly wrapped up on our conversation here. That's been so wonderful, Tennille. Thank you so much for the time. What's next for you and the RCM team, and then maybe ApolloMD as a whole?
Continued success, continued growth, and just continuing to work with this great team that we are and that we have, and just seeing ApolloMD just go to the next level.
Entirely. Entirely. Well, it's been so inspiring to speak with you. Your career and your time here at ApolloMD is a shining example of how every RCM leader should try to blueprint their career. So congratulations to you and to ApolloMD. What's the best way for the audience to get in touch with you?
They can find me on LinkedIn.
Amazing. Yes. Okay, a simple search, and we'll be sure to add that to a follow-up to anybody who looks and views this interview. Again, Tennille, thank you so much for your time, and for all of you at home, feel free to visit us at adonis.io for more information. Thanks again, and we'll see you in the next episode.